So hello and welcome to the National Adaptation Forum webinar hosted by EcoAdapt. This webinar is the online convening of the adaptation community between biennial National Adaptation Forum events. Visit the National Adaptation Forum website to learn more about past forums, including our most recent gathering this past April 2019. We are beginning to plan for the 2021 forum, so please stay tuned for more information as details unfold. I'm Molly Johnson, one of the National Adaptation Forum organizers, and I'll be your moderator for today's webinar. Today, as a part 3 of our Summer Rewind series, we will be revisiting Building Climate Resilience by Connecting to Health. Before we get started, I would like to go over some housekeeping rules to ensure a successful webinar. Please place telephones, cell phones, or computers on mute. This will help reduce feedback. If you are using microphone voice over IP option, please ensure you place your computer on mute even if you are listed as muted when logged in. We will have time after the presentation for question and answers. Throughout the webinar, you can use the question function to submit questions to presenters. We will do our best to answer all of them. You can also type the questions into the chat box for us to pull from. Please use the chat function to report any technical issues or problems you might be encountering. We will try our best to help you address any problems to ensure you have a favorable webinar experience. The chat function can also be used to communicate between attendees. As a way to emphasize a point heard during presentations, we encourage you to engage with your fellow colleagues that way. We will be recording and posting the webinar in the Climate Adaptation Knowledge Exchange website for future viewing. The webinar should be available online next week and can be viewed at cakex.org. The presentations will also be available online as PDF in the EcoAdapt website, ecoadapt.org/webinars. Much of this webinar will consist of replaying the webinar recording from 2018. Sound for this video will only be available through your computer speakers. So keep in mind that if you called in via the phone, you will not be able to hear this portion unless you turn on your computer speakers. Once again, if you have any trouble, reach out to us via the chat box, and we will do our best to resolve any issues. Additionally, we wanted you to be aware that certification maintenance credits, or CM credits, are available for the webinar today through the American Planning Association. You can evaluate the session through the CM search on the APA website. Please contact us if you have any questions. I'm pleased to introduce the presenters for today's webinar. Nissa Tupper works as a Climate and Health Program Manager at the Minnesota Department of Health. She engages across disciplines and organizations to develop knowledge-based tools and processes that build capacity through the state to build more climate-resilient communities. Nissa's work is informed by a professional background in communication and landscape architecture, as well as a personal passion for environmental stewardship. So Nissa will be providing us an update on her work that she presented on in 2018. And then we also will have Aaron Ferguson with us for the question and answer portion. Aaron Ferguson is the program manager for the Michigan Climate and Health Adaptation Program. Their mission is to ensure climate change is understood as a public health threat, build adaptive capacity, and implement interventions. Aaron has previously worked with local governments and nonprofits on climate and sustainability planning. This webinar also features presenters from 2018, including Kristin Raab, the Director of the Minnesota Climate and Health Program with the Minnesota Department of Health, Margaret Round, an environmental analyst with the Environmental Toxicology Program at the Massachusetts Department of Public Health, and Glennon Barrison with the Massachusetts Department of Health. So I will now play a clip version of the 2018 recording, and then afterwards, Nissa will give the update on her project. As a reminder, sound for this video will only be available through your computer speakers. So make sure to turn up the volume on your computer or reach out to us if you have any technical difficulties. With that said, here is Building Climate Resilience by Connecting to Health.
Again, I'm Kristin Raab, the Director of the Minnesota Climate and Health Program at the Minnesota Department of Health. And there are 3 things we'd like you to take away from today's presentations. First, climate change is impacting our world, communities, and families now with real repercussions for our health. Second, engaging your state or local public health department or other key health professionals is really critical to solving the looming climate crisis. And 3, there are tools and resources being developed around the country to support your work in climate resiliency and adaptation. And our 3 speakers today are going to tell you about just a few. So it should come as no surprise to you that our climate is changing now. That is not in some distant future, but right now. This is the NASA portrait of the Earth that contains both observed and model data for the atmosphere on August 23rd, 2018, so just a little while ago. The picture shows the aerosols, that is, specks of matter, including sea salt, dust, and smoke from fires in the atmosphere. On August 23rd, much of the west coast of North America was burning, sending huge plumes of smoke and particulate matter across the country. Fires raged in Africa. 3 different tropical cyclones churned in the Pacific Ocean, including Hurricane Lane that sideswiped Hawaii, and a large clouds of dust blew over deserts in Africa and Asia. All of these events captured on this global scale have significant public health impacts for our local communities. Climate change is contributing to a slew of extreme weather and disasters that are costly and life-threatening. In 2017, the U.S. experienced 16 weather climate disasters with losses exceeding $1 billion, including 3 tropical cyclones, 8 severe storms, 2 inland floods, a crop freeze, drought, and wildfires. The 2017 total number of events tied with 2011 as the highest number of U.S. billion-dollar disasters since records began in 1980. The 2017 events led to 362 deaths and cost $306 billion U.S. dollars in total direct costs. This is a new U.S. annual cost record. And these dollar estimates do not take into account the lives lost, injuries, the lingering health effects, and then the devastating impacts to well-being and quality of life from the event. The atmospheric concentration of carbon dioxide, the main greenhouse gas, now exceeds 410 parts per million, the highest level in 800,000 years. Global average surface temperatures are now 1.2 degrees Celsius higher than they were before the Industrial Revolution. Climate change is not only producing more extreme weather events, it is also affecting more subtle changes in ecosystems and habitats that are conducive to pests and pathogens. This is a diagram from the Centers for Disease Control and Prevention, otherwise known as CDC, which shows the increase in geographic spread of reported Lyme disease cases from 1996 to 2013. Climate change is affecting health directly by increases in extreme weather and precipitation, air pollution, and extreme heat. Climate change is contributing to a spread of diseases, including diseases spread by insects, ticks, and rodents. Flooding due to extreme precipitation contaminates water and crops. Drought and wildfires are destroying and disrupting food supplies, which can lead to hunger and malnutrition. Climate change is causing acute mental health problems like post-traumatic stress syndrome from experience with severe disaster events, or even longer-lasting impacts like depression. And climate change is impacting even more aspects of health, as highlighted on the CDC slide. But there is a ray of hope. Better and more responsive planning to these changes will not only save lives, but it can prevent the economic collapse of hard-hit communities. Starting with health in any discussion of preparing for climate change can ease political tensions and give everyone a common value as a foundation and a goal for planning. Everyone cares about health. Everyone cares about their own health, the health of their children, family, and friends. So invite your health professionals to the table. There are a lot of state and local public health departments and health professionals that have unique knowledge and skills. Plus, they tend to be trusted allies when entering potentially contentious areas, and they want to engage in climate resiliency action. Our program, the Minnesota Climate and Health Program, funded by the Centers for Disease Control and Prevention, got its start around 9 years ago with several other health departments passionate about addressing the health impacts from climate change. Currently, CDC funds 16 states and 2 cities through its Climate Ready States and Cities initiative, which charges states and cities to address climate change threats to health through a rigorous process of study, planning, action, and evaluation. So today, you are going to hear from 3 state health departments funded by CDC that have been collaborating with stakeholders from many different professions to develop useful tools to build climate resilient communities. And just a quick reminder about our 3 key points from today's presentation. First, climate change is happening now and it's impacting our health. Second, engaging your state or local public health departments or other key health professionals is a great way to find common ground and create resilient communities. And third, there are tools and resources to support your work in climate adaptation. And with that, I'd like to hand the stage over to our 3 speakers to tell you more about those tools. And thank you.
All right. Hi, everyone. Thank you for taking the time to listen in. I'm Aaron Ferguson, the Program Manager for the Michigan Climate and Health Adaptation Program. And I'm presenting today on a joint project with Michigan State University Extension to develop a climate and health adaptation guidebook for Marquette County, Michigan. And for those that aren't familiar, Marquette is located in Michigan's Upper Peninsula along the shores of Lake Superior, the largest of the Great Lakes. This project stems from our previous efforts to implement the CDC's Building Resilience Against Climate Effects, or BRACE, framework. As part of the BRACE requirements, we conducted a statewide vulnerability assessment for waterborne disease, respiratory disease, and heat illness, and also evaluated the existing literature on climate-related public health interventions. What we found through that process was, 1, there are a number of communities that are at risk from climate change, as Kristin described before. 2, few interventions have actually been tested, particularly for rural areas and ones that are focused on vulnerable populations. And 3, though the health impacts are clear, many of the opportunities to intervene lie outside the traditional public health sphere, which necessitates building cross-sector partnerships. So the purpose of the Marquette Climate and Health Adaptation Guidebook is really to pilot a process that connects community planning and built environment design with public health in order to build adaptive capacity and prevent or reduce human health impacts from climate change. Though we are currently focused on Marquette, we intend this process and the outputs described in this presentation will be evaluated for effectiveness as an intervention and synthesized so it can be replicated in other areas, particularly in other rural communities. As a starting point in Marquette, we knew it was important to build trust and get buy-in from across the community. The process we used to do this was heavily influenced by the experience and skills possessed by Michigan State University Extension. When working with communities, they focus on leveraging existing relationships to build new networks, creating iterative feedback loops for engaging stakeholders, and utilizing imagery as a means to help those stakeholders understand the complex issues of climate and health. One of the reasons for piloting in Marquette was that it presented a unique opportunity to focus on developing solutions rather than starting with fundamental education and awareness. The area already had a number of climate action plans in place and a coordinating body called the Climate Adaptation Task Force. So rather than recreating that foundational work, our team concentrated on adding the perspectives of vulnerable populations which weren't explicitly considered previously, and utilizing a health lens to prioritize the climate impacts and potential adaptive measures. Over 4 months, the team met with over 30 community stakeholder groups representing a wide range of expertise and experience. We made a point to meet most of the groups where they were and really let them tell us about their experience and what would benefit them. The results of those conversations were brought back to the Climate Adaptation Task Force so they could see for themselves what gaps existed in their existing plans and to help them prioritize the issues going forward. In November 2017, the team presented that stakeholder and task force feedback to the broader community for additional input that we may not have picked up on the first time through. We asked them to further refine the priority issues, point us to specific locations across the county where they see climate-related impacts occurring, and describe their vision of what their community would look like with those issues resolved. And here you can see some images and some of the feedback that we actually captured during that meeting. Out of that first community meeting, 4 overarching issue areas emerged. The first was emergency response in extreme events, which focused primarily on concerns over accessibility to essential services during extreme events. Marquette, for the most part, is a pretty rural community, county with lots of communities spread out, and so travel between them, if a road gets washed out or there's a fire that is blocking the road, it creates a lot of barriers for people to have to go around. The second overarching issue was water related, and so they were concerned with things like riverine flooding, but also coastal inundation and erosion. Drought has been an issue there, and then both the flooding and the drought have caused water quality impacts. The third overarching issue was vector awareness, which, as you saw from one of the slides that Kristin presented, is really a result of Michigan being an emerging area for exposure to ticks and Lyme disease. And the fourth overarching issue related to air quality impacts. And this was primarily from an increase in local wildfires that they've seen. But then again, as Kristin also showed, an increase in particulate matter that's being blown in from a number of increasing fires across the United States and also in Canada. So from those sort of 4 overarching themes, we developed some exposure pathways, which you can see here, that described how climate change impacts that the community identified could directly and indirectly lead to negative health effects. And this also helped us start mapping out thinking about areas or points where we could create adaptations to intervene between the climate impacts and negative health outcomes. So with that information in hand, the team traveled around the community and captured images of locations that were representative of the priority climate issues and health impacts that were identified. Those images were then modified to show what the space could look like and how it would function after adaptive measures were implemented. Symbology was used to link the adaptations in the image to the appropriate overarching issue areas which they were meant to address. For some of the images, we identified sample policy recommendations that would enable the adaptations to be implemented and also provided some sample metrics for measuring effectiveness in the future. Here is an example of a before image of a small community within Marquette County known as K.I. Sawyer. And K.I. Sawyer is a former air base that has been converted into housing basically, and is now one of the more isolated and impoverished areas in the county. The concerns here that we heard were around reduced access to essential needs all the time, but particularly during flooding and wildfire, they're cut off from a lot of the rest of the area, exposure to ticks, and issues relating to depleting aquifers and water availability during drought. Now here is an example of a rendering of sort of the after image of if we were to put some adaptive measures in place, this is what it could look like. And this is the same rendered image, but also includes superimposed over it a description of the adaptations or interventions, and you see those listed at the top. The symbology, which you will probably recognize from those pathway diagrams, we try to utilize that symbology to track the connections between the impacts and the adaptations throughout the entire guidebook. And then here you can get a better look at some of the sample policies and metrics. So we showed those images to the community during the second meeting to find out what they liked, what they thought could be improved, and if we missed any critical locations or recommendations. The attendees had the opportunity to directly comment on the images and also talk with our team. So with several rounds of feedback in hand and more deliberation with the Climate Adaptation Task Force, we decided to break up the final adaptation guidebook into 3 volumes. The first is to be a summary of the entire process that will also contain all of the imagery and design renderings. It's meant to be more accessible to the community and all stakeholders involved. The second volume will present the recommended adaptations, the enabling policies, and metrics for impacts identified. And you can kind of see that volume 1 is represented by the image in the lower left corner, and that volume 2 will look like the image in the upper right-hand corner. And that volume 2 will target more of a technical and decision maker audience. Now, those first 2 volumes are being reviewed by key stakeholders right now, so they've been drafted, and we are intending to release them this fall. The third volume will be developed in 2019 after the first 2 volumes are released, and will reflect a prioritization of specific adaptations that the community wants to pursue and describe who will have ownership of those activities. So we sort of have to put these volumes 1 and 2 out there first, get the community to dive into them, and then we go back to phase 3. So just a few closing thoughts on what we've learned so far. One is that the visual design approach provided a gateway for presenting a complex topic and helped stakeholders understand climate change in their local context. 2 was framing climate change through the lens of health impacts while using planning and design interventions brought together a wide variety of affected populations and disciplines. 3, understanding and acknowledging the community's unique identity was crucial for building trust from the start. Number 4, in a rural county, one-on-one involvement of vulnerable populations often requires additional outreach and feedback loops. And I really want to emphasize that because it tends to be an area in a lot of these projects that we don't do enough of. So we have to continue to go out and bring them to the table, not just send an email invitation. And 5, though not every community will have a countywide multidisciplinary steering committee like the Climate Adaptation Task Force already in place, we find it is a crucial factor for adaptive capacity and is necessary for long-term implementation of interventions as we've recommended. So thank you. Here's my contact information if you have any more follow-up questions after the webinar today.
Next up, we have Margaret Round. Take it away, Margaret.
Thank you, Lauren. First, let me introduce my colleagues that are here with me, Glennon Barrison and Kate Adams, and they're going to chime in and help out with this presentation. To provide some context on what we're going to be talking about briefly today, I wanted to mention about the determinants of health and something I'm sure that you've heard about, that 40% of the premature deaths are caused by behavior patterns that could be modified by preventative intervention. And so with that in mind, we also think about different aspects of vulnerability in Massachusetts. And while Massachusetts is considered one of the best states for healthcare access, for example, and is typically rated in the top states for health, when we start to look at data at a more refined geographic scale, we find that, for example, we might have the lowest infant mortality rate in the nation, but then when we look at racial and ethnic disparities, we find that Black, non-Hispanic, and Hispanic infants are 2.1 and 1.5 times higher than that of our white non-Hispanics. Another example is Massachusetts is one of the highest rates of asthma. We also have Black non-Hispanic males have one of the highest homicide rates, 30 times higher than the young white counterparts. And then also low-income communities and communities of color have a higher prevalence of childhood blood lead levels. So to address this, our commissioner and the Department of Public Health have developed what is called the Massachusetts DPH House. And it represents the foundation on which we work to achieve our vision and mission. And the core drivers of that are related to using data effectively, social determinants of health, and addressing health disparities. So to give some context for climate vulnerability assessment, we start with a study that we had conducted some time ago, actually with the environmental public health tracking colleagues who I'm going to, Glennon's going to talk a little bit about shortly. And we did a study on the heat vulnerability index and what it represents overall in terms of health impacts. And we found that the index itself represents overall vulnerability to climate impacts, not just heat. Also, communities with high existing health burdens are less resilient to pending climate impacts. We identified the importance of GIS mapping to look at these indicators and to inform decisions, and that was just demonstrated by Aaron. And assessing the co-benefits of actions taken now to reduce health impacts may be useful to incentivize local planning activities. So as Kristin mentioned, we have a long history here in Massachusetts with funding from CDC, starting back with the CRSCI and then with BRACE, as Aaron mentioned, and now we are with CHAMP. And two important milestones that I'll mention to you along the timeline there. One is that in 2016, the governor signed an executive order that's requiring climate adaptation planning both at the state level and at the local level. And we are about to publish the State Hazard Mitigation and Climate Adaptation Plan in the next couple of weeks, which actually combines the FEMA State Hazard Mitigation Assessment with a climate adaptation planning process. This is the first in the nation, and I encourage you to come back to our website to get the link for that in a couple of weeks. So in general, our focus has been to look at and evaluate and strengthen local health response to climate change. We do that by collaborating across jurisdictions, implementing the CDC BRACE framework, and then we also sponsor trainings, and importantly, we have used the Environmental Public Health Tracking Portal as our platform to reach our stakeholders and the public. So to illustrate how we are thinking about this, we have climate hazards, exposure risks, and vulnerabilities. And the implementing interventions and adaptations breaks the pathway connecting climate hazards and health risks in a number of places, as you can see here. And so there's a number of examples where interventions can address, in this case, heat and air quality impacts, and ultimately reduce and vulnerabilities. So now I'm going to pass this over to my colleague, Glennon, who runs the Environmental Public Health Tracking Portal program here and at DPH.
Hi, everybody. Thanks, Margaret, for letting me chime in here. So this slide just represents the reach of the Environmental Public Health Tracking Program. For those of you who don't know, tracking for short is also a CDC-funded program, and in Massachusetts we've really leveraged the fact that we have both a climate and health group and environmental public health tracking, and tried to maintain that partnership over the years. So environmental public health tracking program in general was started in response to a study released by the Pew Commission, in 2000, identifying a gap, data gap essentially, that population-wide evaluation of how environmental exposure can lead to chronic disease was not readily available. Traditionally, we've targeted local health as our primary audience and data users, but as our reach has expanded, we've included groups like academia, educators, advocacy groups, hospital associations, planning associations. So this is a quick snapshot of the Environmental Public Health Tracking landing page for Massachusetts specifically. I would encourage you all to take a look at the site on your own if you'd like to see what tools and data we have available, because we're just going to be able to have show you a very small portion of the portal today, specifically the vulnerability mapping tool that gets at some of the larger issues around climate change. So our site does have the capacity to selectively query specific environmental and health indicators to generate dynamic maps, tables, and charts. So again, I would highly encourage you to take a look. So this is just a quick overview of some of the data sets we have available on tracking. It's not all inclusive, and we are constantly updating, but we've kind of binned them in the health realm and the environmental realm, and that helps kind of lead us to kind of filling in data along the lines of the pathways that Margaret has just described previously. So here's an example. If you are thinking back to the kind of hazard environmental indicator pathway, this sort of allows you to visualize the heat and air quality example using EPHT data sets to evaluate risk and potential interventions. Ultimately, the goal being that EPHT can be a platform for presenting, data and tools to inform decisions and address climate-related health impacts, really focusing on local knowledge and local information to effectively implement those strategies and prioritizing our communities with limited resources. So without further ado, I think the next slide will take you to that demo.
But we're going to show just a series of slides to give you an idea of the kind of information we have on our mapping tool. This is just an example. We have web pages that provide background information on what I discussed previously, but here is our focus on our particular program and the BRACE framework and the work that we're doing to essentially implement each of those steps. We also have our vulnerability web page, and here we are focused on looking at those areas of exposure, sensitivity, and adaptive capacity, and how those together define vulnerability of human health to climate change. Here are the layers that are available on the tool. They include demographic, social economic layers, as well as some that we have recently developed here. So we start with a very important group here in Massachusetts, and that is the percent of 65 and above living alone. And you can see that there are a number of cases where there's communities that have, almost half of the population are in that category. Next slide, please. Then we also look at community percent below poverty level, and again, you can see that across the state there's quite a variation, all the way up to about 35%. And then here is our the slides that actually Kate Adams has developed the data sets for, which is the estimated population over 100 living in the flood zone. And then in the next slide, which I take from an example that Jason Vargo from California DPH has put together, where we identify those populations that are living in the flood zones and are over 65. And this is an important approach that you could use to identify those communities that you want to prioritize or that need to have a special focus regarding flooding and elderly. The next slide is our disclaimer, and I imagine that I'll be able to provide contact information more down the road.
Thanks so much, Margaret. Our last presenter today is Nissa Tupper.
All right, great. Thank you, Lauren. So as mentioned, I'm Nissa Tupper, Program Manager for the Minnesota Climate and Health Program. And I feel so lucky to be here today speaking with some of my CDC grantee colleagues and sharing our work with you all. So the project in Minnesota that I'm going to highlight is our most recent work to develop our climate and health data profiles for our emergency management regions across the state. This effort really involved building new relationships with colleagues across a range of disciplines, pooling our creative energy and resources to better plan for climate and health impacts in Minnesota. But before I dive in, I also want to make note that this project came to fruition because of Dr. Brenda Hoppe, who's our program's research scientist. Her dedication, smarts, and energy were really key drivers behind this project over the past year, and I hope the brief overview I give today does some justice to explaining the impact of her efforts for our state. So as Kristin mentioned earlier, our program is guided by CDC's Climate Ready initiative, which lays out a number of steps for studying climate change impacts on health at the state and local level. Besides grappling with climate data, grantees also take their understanding of climate threats to health and identify interventions or strategies for reducing those threats, and then implement those strategies.
Certainly, climate change is posing new challenges, but many climate change challenges are honestly ones that we've been tackling for years. Climate change is just making them worse and more frequent. So being tasked with implementing interventions, we quickly came to appreciate that the most effective approach we could take would be to identify those individuals already on the front lines, grappling with some of the most pressing climate change threats, and explore how we could support their knowledge and planning efforts around climate change. So we set our sights on emergency management and preparedness professionals. EM&P professionals have a long history of successfully planning for and responding to extreme weather events and disasters of all kinds. They tend to have extensive partnership networks with local coverage, providing real-time assistance to impacted communities down to the household, even individual level. EM&P professionals being on the front lines, they often witness firsthand the very personal and wide-ranging impacts of a disaster event on a community. So while those of us in public health have some valuable knowledge and expertise related to climate change, EM&P professionals are intuitive partners because they're much more powerfully positioned to advance resiliency in our communities. So now, being from Minnesota, we felt the need to incorporate at least one hockey reference. So here's a little wisdom from Wayne Gretzky. Wayne's been quoted as saying that one of the reasons for his domination in the rink is that he skates to where the puck is going to be, not where it has been. And that's the same philosophy that we need to guide us in our planning, not only for extreme weather events, but really for all climate-related hazards. When we started reaching out to state and local EM&P partners about how to support their engagement in climate planning, one of the main things we heard about was the need for data and information on what the climate change future may look like for Minnesota communities, and in a form that would be accessible and meaningful. It was really clear from the start that we need to focus on where we're headed, not where we've been. And climate data can help us tremendously in that effort. When we refer to climate data, we're referring to climate projection data. Climate projection data are estimates of future temperature and precipitation measures or other climate characteristics that are derived from very sophisticated global climate models for time periods decades into the future. The source of climate projection data that we drew on for our project was USGS's National Climate Change Viewer, which is a well-vetted and user-friendly data source. There are actually quite a number of online sources for climate projection data that have recently become available. However, using these data sets for specific applications does require some guidance and support. And to that end, we're extremely grateful for the partnership we have with our state climatology office. They were really instrumental in helping facilitate this project, and we'd encourage those who are interested in exploring these data to also find expert mentors who can provide support along the way. So as a way to help planners and decision makers in emergency management and related fields understand regional climate trends and ultimately champion climate and health resiliency, we developed climate and health data profiles tailored for each of our state's 6 Homeland Security and Emergency Management, or HSEM, regions. So far, we're receiving great feedback on how our partners plan to use the information in their mitigation plans and other emergency-related planning documents, and also for factoring into response and recovery-related exercises and scenario planning efforts. Each profile, as you can see on this slide, this is the opening page, contains an introduction with general information on climate change in Minnesota, specific information on the targeted EM region, and a bit more detailed discussion on specific climate change trends for Minnesota, including the importance of tracking population trends, since climate resiliency is based on addressing key population vulnerabilities within our community as well. From there, we dive into region-specific climate data, including projected population changes alongside some baseline historical data, so you can see how the measure is projected to change from the past. Each data table is prefaced with some trend information specific for Minnesota. With regard to the population projection data, data are provided for both child and senior population changes, as these groups are often identified in climate and health literature as having specific vulnerabilities, needs, or concerns that make them uniquely vulnerable to climate threats. Then we present a case study that aims at putting all this climate data information into a real-world context that many readers in EM&P may also have had experience with. This section of the profiles is pretty unique and is evidence of why it's important to involve leaders of your intended audience when you're developing communication materials like this. Our intention with the case study section was not to say that climate change definitively caused these disaster events. What we're trying to do is compare future temperature and precipitation projections for the region with the same measures that were associated with a past disaster event to demonstrate the potential impacts of these future projected trends on our communities. We know that stories are what really engage people. It's just Not that meaningful to hear that, for example, maximum summer temperatures for your region may rise by 7 degrees in a few decades. However, it does become much more meaningful to see that those high temps associated with a recent drought event were similar to what's being projected as a new norm for your region just a few decades from now. So we spent a few pages on this case study, or focusing event, if you will, and each profile features a different event that has a significant impact on that region. So we asked our state EM&P and climatology partners to come up with those disaster events, and we wanted them to be particularly notable for each region, and you'll see those on the left-hand side of the slide. Together, these 6 profiles cover many of the top climate-related disasters that are priorities for both the EM&P sectors and for our field of climate and health. And so for the case study section, we open up with some background information on the event, and then we provide some examples of the impacts from the event to underscore the cost to the community. And those costs are both financial and also to health and well-being. And then we provide the data, graphs that provide a clear comparison between historical trends, future projections, and data specifically associated with the disaster event for maximum temperature, minimum temperature, and total precipitation. So with just 3 variables, it's clearly not a sophisticated climate change attribution analysis. But what it is an effort to highlight these data, jumpstart some conversations about what these data are communicating, and hopefully inspire EM&P practitioners and their partners to explore these data and their potential for planning. And then to wrap it up, we provide a summary interpretation of the case study graphs and some final words on the importance of climate projection data, some general next steps or suggestions for how EM&P professionals can advance climate resiliency work in their area of expertise, and a brief list of resources. So looking ahead, we hope to continue building relationships with our EM&P partners, and we plan to convene a climate data technical work group to provide support to public sector planners and responders, like EM&P professionals, and others on where to get the right climate data for the project they're interested in, the best options for using these data, and assistance with interpreting their meaning in the context of specific projects. Ultimately, we hope that this technical work group will provide a space for data users to learn from others and really get inspired to, nod to the past slide, skate to where the puck is going, not where it has been. So with that, I'll note that you can download the profiles from our website, which is listed here on the screen. And then I guess I will turn it over to the group for questions, and all of our contact information is listed here as well. Thank you.
Hi, everyone. So thank you for watching that rewind, and we will pass it over to Nissa to give an update. And I would just encourage you all to submit any questions you have for Aaron or Nissa into our question box or the chat. Thanks. Take it away, Nissa.
Great. All right. Thanks, Molly. So hi, I'm Nissa Tupper, and again, I'm on to provide a few updates about our work with emergency managers. So since co-creating these profiles, we've focused not only on getting the word out there, but also building deeper relationships with our partners and supporting capacity building efforts to help translate research to practice. We released the profiles last August with a webinar tailored to our EM&P partners, and the profiles are now hosted on our website, so they're publicly accessible. And we've also included the county level projection data in a downloadable format for all 87 Minnesota counties. Our research scientists, the lead author on these profiles, also arranged personal visits to each of the HSEM regions. And some of these visits, ironically, were rescheduled due to weather impacting travel over the winter months, but we worked really hard to coordinate so we could roll these out locally and in person. This gave us the opportunity to build deeper partnerships and make the state more accessible at the local level, while also providing our partners an opportunity to ask specific questions. So in addition to fostering relationships and accessibility, a big opportunity with these profiles is to serve as a building block for EM&P to use climate projection data in their planning process. Structurally, this opportunity is with getting the information embedded into our all hazards plans. We worked with our state Homeland Security and Emergency Management folks to integrate this information in the 2019 State All Hazards Plan, and are also working with stakeholders to embed the information in the county level all hazards plans. County hazard mitigation and response plans are a bit tougher to chase because they're developed on a rolling basis, but we have some great allies who are helping us champion this work over time. So with county level plans being updated on a rolling basis, we didn't want to wait years to assess the pickup rate of the information. We also didn't want to miss any important opportunities to be responsive to this group's needs. So we are conducting a short-term evaluation to gain insights about EM&P's attitudes, subjective norms, perceived behavioral control, and barriers related to the use of climate projection data. So this type of evaluation is rooted in the theory of planned behavior, which has been used to predict and explain intentions and behaviors. With planning efforts happening on such a long-term time frame, we're hoping that this type of evaluation will help effectively steer our next steps. So the results you see here are from our webinar evaluation, which indicated that 95% of EM&P intend to use climate projection data in some way, primarily by integrating it into hazard mitigation and response plans. 92% felt it would be helpful to use the data, and 88% expected their peers would be supportive. However, we found that only 44% were confident they could use the data. Key barriers here included beliefs about social norms and also control. So we're currently adding to this sample through evaluation efforts from our regional meetings, where we also handed out the same survey. Our preliminary analysis of those meetings was just wrapped up last month. Of the in-person visits reinforced what we learned through the webinar evaluation. We're still combing through the data, and we also intend to publish the results, but I guess as a sneak peek, we're encouraged to see that 100% of the EMs we surveyed intend to use climate projection data in one or more ways. And the top response for barriers to doing this included not having the time or resources. So knowing this really helps us set direction for offering support, which I'll get into on this slide. But also long-term, we're evaluating if EM&P follows through on their intentions of using the data in county hazard mitigation plans. So in 5 years, we hope to take a look at samples from across the state. So in the meantime, we're following up on what we've heard loud and clear, that our partners need more resources and support. So we're providing a space for EM&P along with other public sector professionals to join a learning community about climate data. So we facilitated our first Minnesota Climate Data Community of Practice earlier this year, and we had a great turnout from university and state and local government partners. And we're currently planning and reconvening the group this fall to continue formalizing the charge to build capacity for using climate data. So if you'd like to stay in touch about upcoming meetings or learn more, please take a look at the webpage noted on the slide, or feel free to get in touch with me. So lastly, before questions, I just wanted to share some key learnings that we've noted throughout the process, and if you just advance a couple times here. So first, we found that co-production of knowledge can lead definitely to more meaningful results. So we found that taking the time to initiate partnerships with our state and regional EM&Ps, asking for their feedback, and then following up to show how we incorporated it, has not only allowed us to take this project deeper than we anticipated, but we're also breaking down these invisible yet really tangible silos that often separate us. Second, adoption is highly dependent upon organizational support with nuances. Organizational or supervisor support for learning about and applying climate projection data can vary widely, making it challenging sometimes to partner with individuals across disciplines and sectors. This has been a widely recognized barrier to increasing access and use of climate data. However, our experience shows that connecting with peers through a knowledge co-production process not only provides them with useful information, but can also empower them to advocate for the support they need in order to advance climate data use. And lastly, there's a perennial need for better data. We had to make some really tough decisions along the way about what data to use, how to use it, and when to tie a bow on it, so to speak, so that we could advance this project and develop products for our end users. This pertains to all data portions of the project, from the climate projection data to local level impact data and population level data. So for example, for our climate projection data, we relied on the National Climate Change Viewer, which has a number of advantages. However, at the time, the data were available as monthly estimates only, which can mask extremes. So we have an immediate need here, especially in Minnesota, to fill this information gap, like many other jurisdictions, with dynamically downscaled data. In terms of local level impacts, there's very few systems in place that really capture or characterize disaster impacts at the local level. So to provide context about those in our profiles, we really relied heavily upon media outlets that represented small community and tribal populations, as well as resources from our regional contacts to gather that information. The other data that we needed was in regards to population, because advancing disaster resiliency really depends on addressing a broad range of population vulnerabilities. And it was difficult to locate and obtain projection data, we relied on our state demographic center, but they've produced demographic projection data for 2045 as compared to 2015, but that's only for population, sex, and age. And so we recognize that the information in our profiles are really just a drop in the bucket. But at the end, you know, we really went away with do the best you can with what you've got. And you have to start somewhere so that you can make some progress. So lastly, I just want to acknowledge all of our partners from EM&P to the others that helped make this project so rewarding. It was very cross-disciplinary and collaborative, and we're grateful that so many were able to lend their time and expertise for this partnership. And with that, I will close, and I think we'll move on to questions.
Thanks, Nissa. So let's check in with Lauren and see if she has any questions for Nissa or Aaron.
Thanks, Molly. The first question we have is for Aaron, and that question is, have you released Volume 3 yet? And how are you determining the adaptation priorities in this part of the process? Slash, are there any lessons learned?
Yeah, so since the presentation, we have released volumes 1 and 2 publicly, and then we held another community forum to go over those volumes. And during that forum, we asked the participants to break out into those 4 overarching health themes to sort of self-select and help us further prioritize the recommendations that were in those reports, because especially Volume 2 was more of a menu of possible policy options and projects. So we walked away from that meeting with these 4 groups that have since turned into community work groups, and they have been continuing to refine what those priorities are and then also localize them. So we're really trying to work towards local ownership now, them taking ownership. And Volume 3 is being drafted right now and will be released, I think next month actually, because we have another community meeting in Marquette coming up. And Volume 3 will show how those work groups have progressed and what they've identified as the priorities. So then the result of that meeting and Volume 3 will be moving into a technical assistant stage where we'll also be working with the MSU extension team to take communities within Marquette County and work on 1 or 2 projects to do some further input on what they want to see at like a very specific site, do some design rendering, and then hopefully, if all goes well, we'll have a few dollars to put towards implementing that. So we'll have, and that will come through the CDC funds through us to the local community, so they can actually kind of see that project come to fruition. And we expect that part of the project to happen over the next year or so. And so lessons learned so far, I think that taking this report and where we've been providing a lot of the recommendations so far, now transitioning to that local ownership has been a really key piece. And so we continue to try to build that local capacity and that local ownership over these issues.
Thanks so much. The next question is, in the implementation of the community and state level climate/health measures, is there overlaps or gaps or support/resistance about these efforts at the federal level?
Is that question for either one of us?
Yep, either one of you could jump in on that one.
I guess just speaking from Minnesota, so the question is there resistance from the federal level for our work?
Yeah, is there support or resistance?
Yeah, no, we are supported. So both of our programs, and Eric can chime in here too, are supported through grant funding from the Centers for Disease Control and Prevention. And we come up with a work plan each year and are guided through that process and supported throughout the year and report on it and come up with our next plan. And yeah, I think our support is solid at this point.
Yeah, I would agree with that. The CDC in particular, I think over the last year has really been great at providing us with like some communication tools and templates that we can use to help communicate, but we can also share with other local health departments and even the other state health departments that want to be able to do that. Then they've also created some additional guidance that's, I think, based off a lot of the work that you saw today, which is how do you partner across sectors and work with other partners. So they've been developing some guidance based off the results of our work and trying to spread that, spread those practices even to those that aren't funded.
Excellent, thank you. We actually got a bunch of questions, so we're gonna have to probably save some of these to answer via email. Another question was that Nissa mentioned working with tribes. Was the data from the IHS or local tribal clinics?
Let's see. So for this iteration, we did not have specific data for the tribes in Minnesota. And the data was cut actually based on Homeland Security and emergency management regions, which don't necessarily line up with tribal boundaries. So one of our next steps, which I didn't mention, and I apologize for that, is to actually take this process to our tribal partners. And we did receive some grant funding through GLESA to do that. And we'll be kicking that project off in a couple months here. So taking basically the process of creating the profile and doing that through scenario planning workshop, specifically with the tribe. So hopefully from there, we can scale it up to meet other tribal partner needs throughout Minnesota.
Excellent. And then the last question is from Sharon, and she says she's curious to know whether these disaster resiliency initiatives considered infrastructure interdependencies.
I don't know if that was directed at either or both of us, but so in our projects, because we were looking at built environment design and planning, we were really trying to think from like a systems perspective. When there's a major event or some type of event, how the community infrastructure interrelates. So thinking about transportation and then access to essential needs and essential services is something that we did try to consider in our planning.
Yeah, and I'll just add on to that for these profiles that work through emergency management and preparedness. For each of our case studies in each region, we do call out the various impacts from natural disasters and frame those through public health, because really the infrastructure failures are public health issues. So, displacement, disrupted community networks, infrastructure failures like roads or bridges getting washed out, like that all ultimately does impact public health. So we took, we cataloged those impacts and then worked them into our profile to showcase how public health is impacted. So I think definitely they're interdependent and related.
Yeah, we will pass on the remaining questions to our presenters and they will get back to you via email. So thank you all for submitting those great questions. And thank you for joining us today. Feel free to point any colleagues who could not attend today's broadcast to the recorded version, which will be posted on the Climate Adaptation Knowledge Exchange website, or cakex.org. And CAKE is home to hundreds of adaptation resources, including case studies and resources relating to today's panelists. So when you go to share the recording of today's webinar, check out everything else there as well. And keep in mind that the National Adaptation Forum webinar series are run quarterly. So if you would like to recommend a topic or are interested in partnering with our webinar series and co-hosting a webinar, please email us at info@nationaladaptationforum.org. So thank you once again to Nissa Tupper and Aaron Ferguson for joining us today and giving us this update on their past webinar that they presented on. And thanks again to everyone for joining us. Have a great rest of your day.